and I'm going to be talking to you about the eating disorder anorexia nervosa. Did you know that anorexia nervosa has the highest fatality rate among mental illnesses? 1 in 100 women will develop anorexia nervosa in their lifetime, and only 1/3 of anorexic people will actually obtain treatment. Anorexia nervosa is an eating disorder that, although treatable, can create many health complications. Anorexia nervosa can be diagnosed by 4 criteria. A person who suffers from anorexia nervosa can suffer from multiple health complications, which may include hospitalization. Treatment options can either include inpatient, where they're hospitalized, or outpatient, where they meet with a therapist on weekly meetings. First, I want to share the criteria for diagnosing anorexia nervosa. There are 4 criteria that must be present in order for a person to be diagnosed as anorexic. The first one is that the individual is less than 85% of body weight. What this means is that on a health chart they are 50% below what their expected weight should be for their height. And the main factor in this is that they don't even think that they're too skinny. They think they're fine where they're at and they don't see a problem. The second criteria is an intense fear of weight gain. They're so consumed by the thought of how many calories are going into their bodies and the exercise that they're going to need to do to get rid of it that sometimes they don't even eat. It's said that eating, food, and weight control become obsessions. The third criteria is body image. The media has a large role in this. This is a picture of Barbie, what she looks like and what she should look like if she had normal proportions. People have this unrealistic image that they have to be skinny and perfect in order for them to be of any worth. And this is actually an unattainable thing, because if this was Barbie in real life, her head would be 6 inches wider than her waist, which is physically impossible. And the fourth criteria is amenorrhea, and that's a lack of 3 consecutive periods. Obviously, this criteria only is available for women and applies to them only, not men, so it's harder to diagnose males, so it is a questionable criteria. There are causes as to why these diagnoses even come about, and the first one could be genetic. I have a picture of 2 twin girls here, because if one twin gets anorexia, it's likely that the other one will develop anorexia as well. What actually started these girls to have anorexia is that their dad made a comment about their hips coming in, and they made a pact that they were not going to let their hips get big, so they developed anorexia nervosa, and now you can see how low their body mass is and how unhealthy they look. Another role is personal traits, and that is in the sense that perfectionist people and meticulous people will often develop this high standard for themselves, which can lead to anorexia. There's also athletics, usually individual sports, wrestling for males, gymnastics for both male and female, and for females also ballet or any type of dance where all eyes are only on them, so they feel that they must look perfect. There are many complications that result as a consequence of being anorexic. The first one is gastrointestinal complications. This can include constipation, bloating, early satiety, which means they get full, they really aren't full, and even problems with the liver. The second one is it affects the endocrine system, which would be amenorrhea for women where they have those lack of periods. The third one can be bone problems. People will often develop a disease called osteoporosis where their bones get really fragile and weak and brittle. And the sad thing is that during this late adolescent period to early adult period, this is the time period when they need to be getting the most nutrients for their bones, and they're depriving themselves, and their bones will never reach their full potential. They are actually 3 times more likely to get fractures than other people who aren't anorexic. There's also neurological problems. People who are anorexic have cognitive development issues, and they're even more apt to commit suicide. And finally, there's dermatological problems, and that includes the presence of a hair-like structure called lanugo, and mostly occurs on the back. Also, you'll notice that with anorexic patients, their skin gets rough, dry, brittle, anything like that, and they can even have a loss of hair. And although many complications can arise, treatments are available. There are 2 different types of treatments for anorexic patients. The first one is inpatient. It includes hospitalization for about 2 weeks. This may include the use of feeding tubes, intravenous fluids, and structured diets with supervised meals. Usually people are hospitalized because their blood pressure is extremely high, their heart rate is really low, and their body temperature is low. What they do in the hospital is a slow calorie repletion, which is where they they gradually get people back into their normal eating patterns. If you push it too quickly, they're going to get too many nutrients, particularly glucose, and that will get into their cells, which can cause heart irregularities, which can be fatal. So that would be called refeeding syndrome, and that's what they want to prevent. There's also outpatient, which is where they meet on a weekly basis with a therapist. Usually these people aren't as far along in their anorexic journey, so they're more able to get out of it and get back to their normal patterns without help 24/7 with supervised help. So usually when they check in, though, for their meetings, they'll wear baggy clothing or drink a lot of water to make it appear as though they've gained weight, even though they haven't. Usually family therapy can help with outpatient. So anorexia can create various health complications, but many are treatable. It's a serious eating disorder that affects many people across the world. There are specific criteria in diagnosing anorexia nervosa. Anorexic people often develop a lot of health complications, but they can be treated either as an inpatient or as an outpatient. Anorexia nervosa can be detrimental to a person's health if not diagnosed and treated in a timely manner. And I think that using the given criteria, we can diagnose more anorexia nervosa cases and provide treatment much quicker in the hopes that we can lower its high fatality rate among other mental illnesses.